Hello, everybody. Welcome again. This is Dr. Wen, geriatrician with the Department of Geriatric Medicine at JAPSOM and the course director for this Project ECHO Long-Term Care Learning Action Network. It's very good to see all of you again today. And for attendance purposes, please enter your name into the chat box as our way of taking attendance. And if you have a smartphone, please try to do this as well. Okay, next slide. So the Pacific Islands GWEP program at JAPSOM is partnering with the Healthcare Association of Hawaii. Lori, you can wave, hello, right? And Mountain Pacific. I think there's a number of folks here on Mountain Pacific as well. Thanks also for joining us. We are using the Project ECHO model to provide education from quality improvement leadership and implementation experts and combine this with the opportunity for case discussion, for everyone to share experiences and practical ideas from each other as a community of learners. So you are also our partners and we will be learning together. Next slide. We commit to maintain and safeguard the confidentiality of information that is shared. All case presentations are required to be de-identified and HIPAA compliant. And in order to create a safe learning environment, we will foster a culture of mutual learning and encouragement, not negativity, shame, or blame. ECHO Hawaii's case consultations do not create or otherwise establish patient-provider relationships between any ECHO specialists and patients whose cases are being presented in the ECHO setting. Okay, next slide. So this is our schedule. We started this series with the theme Leadership Through Crisis, and now we are going to move on to the next theme, Taking QAPI to Success, with the goal of applying QAPI principles to COVID management. This synergizes nicely with the AHRQ National Nursing Home COVID Action Network that is ongoing weekly right now. So we'll be referring to some of the concepts learned there in order to reinforce learning. Today, our topic, as you can see, is understanding root causes. We will look at identifying outbreak contributors beyond contact tracing, but we are also open to talking about root cause analysis for whatever issues your facilities are working on at this time. Next slide. Our goal is to have nursing homes that deliver superb care and establish a community of learning. But we also want our facilities to be able to apply the QI principles more consistently to better control and prevent COVID, and to provide the Institute of Healthcare Improvement age-friendly health systems in all their patient care. Next slide. This is the case presentation form that that actually can be found when you go to the website link for registration. There is a tab for case presentation tab, and you can click onto the online form, or you can download the form and then email Michaela Ebrau there. And so, you know, case presentation is a critical part of the ECHO experience, and so we encourage you to use these so that we can address your specific questions at our next sessions. Next slide. Okay, this is a slide about CME. The CME activity is sponsored by the Hawaii Consortium for Continuing Medical Education, which is a joint venture between the Hawaii Medical Association and JAPSOM. This program is also approved by the National Association of Social Works Hawaii chapter for up to one continuing education contact hour for this session, and of course, and also for next month as well. And as a reminder, you must complete an evaluation form and in order to receive your CMEs or CEs. And the evaluation can be found under the evaluations tab. And also it will be, the link will be put into the chat box towards the end of this session. And so, and also, don't forget to mark your attendance by putting your name in the chat box so we can keep attendance. Okay, also, if you click on your Zoom box, you can actually change your name and add the name of your facility or organization in parentheses, and that will clarify where you're coming from as well. Okay, so welcome to everybody for joining us again. And we really appreciate your commitment to quality. So today's speaker is Joy Yadao. She is a registered nurse with more than 25 years of experience in nursing care and leadership, and in the specialties of pediatrics, trauma, oncology, wound care, case management, utilization management, end-of-life care advocacy, and infection prevention, as well as quality metrics. So many of you may already know her, as she has held positions at Queens Medical Center, HMSA, St. Francis Healthcare Systems, Healthcare Association of Hawaii, Mountain Pacific Quality Health, and now at Kuakini Medical Center. She's currently an infection prevention specialist at this time over there, and she is developing protocols during a pandemic and is very passionate about utilizing her experience and skills to improve healthcare in the community. As you know, all sponsors of CME are required to execute a conflict of interest policy and disclose any real or apparent conflicts of interest that they may have in direct bearing to the subject matter at hand. Today's speaker discloses that she owns her own healthcare consulting company called About You Healthcare Consulting. However, she is not promoting her services or being paid for services for this talk. She is providing education only. And so without further ado, I'm going to hand this over to Joy. Thank you.
Okay, thank you so much. Thanks for that introduction. And it's so wonderful to see so many names that I do know, some old friends and new friends, and I'm really glad to be talking about this particular topic because when everybody hears that you have to do a root cause analysis or an RCA, as we refer to it, people get kind of, nervous or scared or, oh my gosh, what do I have to do? And it's really not that hard. RCAs are something that I absolutely love doing. It's kind of fun. I consider it like a puzzle, and that's why I use this theme on the PowerPoint. It's kind of like putting pieces of a puzzle together, and an RCA is just the beginning steps, just starting to get that puzzle, kind of started. Some of us that do jigsaw puzzles, sometimes we like to start with corners. Maybe you like to start with the edges of a puzzle. Maybe you like to start with a particular color that's attracting you. But however you start it, there are all different kinds of ways to get to the truth. And that's what we want to do, is how to understand what are the root causes of our situation and how can we use this information to better ourselves and our care. So let's get started. Next slide. Today's objectives, as you may have seen, is to create a quick but thorough RCA. Okay, so we're just going to go through the steps here pretty quickly. I assume most of you are familiar with, what an RCA is. We want to make use of technology because nowadays we're doing things through Zoom. We're using our technology more often, and how, we want to look at how we can use that for root cause analysis. And also specifically identify some contributing factors to a simulated COVID-19 outbreak in a nursing facility. Some of you may have been through something like this or heard about it. Others of you are dreading, and trying to prevent this from happening in your facility. But we should look at it honestly and see how we can start to gather the data that we need. Next slide. So why bother with an RCA? Everybody goes, oh, we don't really need an RCA. And I know that some of you do it as an afterthought after you've already developed your plan, and because we have to have an RCA on record. That's really not the way to look at it. But I know that most of us in healthcare, we like to fix problems. We just have the mindset of skipping over all of the other process and let's just go right to the problem and fix it and be done with it. And the things that I've heard from, a lot of healthcare workers are, well, we already know what the problem is. We don't need to do this RCA thing. And also, the diagrams, they're hard to make. I don't know how to do that on my computer. I don't have those kind of skills or software programs. And that fishbone thing, I don't know how to do a fishbone. That's so intimidating looking. It's got all these branches and I can't even do that. Or just basically, I don't know where to start. What do I do when they say do an RCA? What does that really mean? It sounds complicated. You can look it up online. There's all different kinds of templates to use, all different ways to do it. And most people, again, get intimidated by it and tend to put it off until the last minute, instead of what it's supposed to be used for is the first step in identifying what the problems are. So next slide. An RCA can be very simple, and it can actually be fun. I know people think I'm weird when I say that, but it really is the first step of honestly looking at what's going on in your facility. What could possibly be the causes? And all possibilities are included. We don't exclude, anybody's idea, or even the slightest little thing sometimes can be the real key that opens up and connects the dots. You've got to be multidisciplinary. An RCA is not something that the manager or the DON does in the office after the fact, or even before. This is something that's a brainstorming activity. This is where you get your multidisciplinary team. Depending on what the issue is, you want to have people that know about the process in their department or in their area. So if it's nursing, that's great to have your DON there, but really, wouldn't it be nice to have a nurse's aide on the team, or one of the nurses that takes care of the patients, or depending on what the problem is. If it's dietary, you want to have the dietary staff there. You want to have all the different disciplines, because people see things from a different perspective depending on their training. So even if they're not directly responsible for the incident, they can be very helpful. So, have your social worker there, or your case manager there, have, just everyone who's involved may have a piece of that puzzle. And if you're missing one of the pieces to the puzzle, I mean, there's nothing worse than doing a jigsaw puzzle and finding out you've got some pieces missing. It's a lot of work and you don't get anywhere. And then what I always say is channel your inner 4-year-old child. If anybody has ever taken care of children or has children, at about 3 or 4 years old, there's a hallmark sign of a child of that developmental age. And it's because they're forever asking why. And that is the key to an RCA. You've got to ask why, and not just once. You've got to keep asking it. So when a kid says, oh, why is the sky blue? It's like, it's not time to just go, oh, I don't know, it's just blue because it's blue. Too bad. Let's move on. Let's explore that. Why is the sky blue? Well, I don't know. Is it mirroring the ocean? Well, and then you ask, well, why? Well, is the ocean blue? Not really. I get a bucket of water from the ocean, it's not blue. So what's that all about? And maybe a 4-year-old can't appreciate the rods and cones in your eye and whether the wavelength is long or short. But the idea that you would ask, why is the sky blue? Most of us as adults, we've given up on asking those kinds of questions. But this is the time to do it. This is the time to just go back to pretending you don't know anything about anything and ask why. Why did that happen? And don't be settled with just one answer to why, because after that's answered, you need to ask again, why? And you know how they say, do it 5 times. If you can get 5 whys out of one issue, you're really starting to get to the root of the problem. And that's why we want to do that. So just open your mind, open your heart, and just kind of be a 4-year-old for a little while, just for a little while here. Okay, next slide. Now your team, like I said, every discipline has to be there, but you want to make sure that you're in a space where all ideas are welcome and they're worth mentioning. There's no such thing as a dumb idea or a silly comment. It's definitely something that, everybody is free to say what they want to say. You have to have a tone of confidentiality, and actually, of course, as employees of a place, you're all in agreement that you're going to keep the information confidential. But, sometimes things get, a little bit silly, or you might come up with ideas and then find out that, no, that wasn't really the cause. You don't want that spreading all around your facility. We want to keep, to the topic and keep it confidential in that room. You want to choose people that have a good attitude. You really don't want this to become a complaining session. Oh, well, management always does this, that, and this. And the leadership needs to give us more this, that, and that. Or staff are always doing this and they don't care. This is not a time to complain about all the issues that may be going on, even if they're true. This is the time to look for cause, not to fix the problem, and you've got to have a positive attitude going into it. It's also important to have a facilitator, someone who can maintain the focus, keep everybody going, keep things on track, and on time. You don't want to spend a long time on this. This should be a relatively short meeting. And then how are we going to do it virtually in today's world? We can't necessarily get a group of 5 to 10 people sitting in a room close together looking at paperwork. That's not possible anymore. So how can we think of other ways that we can, use our staff's time and include others who maybe are not working that day, who maybe are working in different locations, whatever your constraints are. Actually doing things virtually now, we're finding, is sometimes better than meeting together. Depends on the situation. Next slide. So the 5 whys, we're usually pretty familiar with that is one way to do an RCA, the 5 whys. And I would suggest that no matter what style you use, what template you use, that you still go through the concept of the 5 whys. Just asking why 5 times, or at least if you can get to 3 or 4 for each topic, you'll really hit on a lot of things that maybe you didn't know. So that idea that, oh, I already know what the problems are and we can just get to the fix. Sometimes you're surprised in an RCA that there are actually some other problems that you didn't know about, or simple things that can be fixed easily that were not brought to your attention. So this way, when you ask the 5 whys, it really helps no matter what format you're using. So you start with the problem, whatever the incident, that happened. In our case today, it's going to be, an outbreak of COVID-19, which is pretty serious, but it can be any incident that, warrants this kind of attention. And then keep asking why until the excuses start to fall away. Because at first there's going to be some excuses of why we can't do that. Well, why did that happen? Oh, well, because, this person or that person or this process or that thing wasn't where it was supposed to be. And there's all kinds of pointing fingers. We want to let that fall to the wayside. That's not helpful. It's not about people. It's about process. So human error, although might be involved, is rarely a root cause. Okay, kind of let that sink in a little bit, that human error is rarely a root cause. If you've got a lot of human error, then obviously you need some more training, or you need different people working for your organization. This is not a common root cause of an incident. There's more than human error. It can be that that's a component, but let's get beyond that and keep asking why, because why did the human break down and was not able to do the right thing? There's usually a system failure involved. So keep looking for that real or potential system failure that you find. It might be in paperwork, it might be in process, it might be in policy, or understanding of the individuals, because I'm sure none of your employees come to work, and say at the start of their shift, gee, I want to spread some COVID-19 around to these poor, vulnerable residents. I doubt that. I doubt that anyone comes to work saying, I want to hurt somebody today. All of our staff are dedicated people who do the job that they love, taking care of your residents. And it's the system that often fails them, and we need to look at that as your real root cause. When we finally get down to one or two or three actual root causes, it should not be people. It's going to be your system. So we keep asking, but why? Why did the system fail? Why is this happening? Why is the sky blue, Mommy? Next slide. So I say keep it simple. We all know the KISS, but I say it's keep it simple, smarty. It's nobody's stupid in this process. We're all smart people, but we want to keep it simple. This should not be, actually this presentation should probably be longer than your RCA, because you want to just get to the simple root of things so that you can move on to actually plans of correction or performance improvement plans. So the facilitator has to encourage everybody to participate. So when you see somebody, like on a Zoom call, we've got a whole bunch of pictures of people or lists of names, the facilitator would call on people maybe that are a little shy or haven't given their opinion yet. It'd be like, hey, what's happening? What do you think about this or that? And encourage everybody, because no idea is too small for this. Sometimes it just comes out of left field and you really find, one of the key answers to your issue. The best ideas are very simple. So we want to keep it simple and stick to the identifying causes, not the solutions. I find that doing RCAs, everybody, when we shout out ideas or we all take turns in contributing, we want to give the solution. So try to keep from doing that in your head and just look for the cause, because you're going to get to the solution later. That's not what a root cause analysis starts out to be. We want to get the causes and then move on to solutions. So it'll be there, just not yet. This is just the first simple step. And then your virtual platform. Again, thinking about that, I'm sure you're thinking in your head, well, how can I do this virtually? Easier than you think, because you can sit in your office or at home or wherever you happen to be, even on the beach, and do an RCA with everybody. Next slide. So choose a platform. I don't know what everyone is using. I've used so many different things, meeting with different people. Zoom, I think, is the easiest one, but you have Teams, Microsoft Teams, GoToMeeting. There's so many different kinds. I'm sure many of you are already using something. And if you're not, then you might want to consider Zoom. I'm not trying to sell Zoom or anything, but I find it easier. You can get a free account. It's not, too difficult. Most people know how to use it now, or it's easy to learn. We'd prefer the camera, and I say that with full knowledge that I'm not on camera for you, but that's because I don't have a camera right now. But a camera is preferred. So if people need to use their smartphones or if they have cameras at their desktop, it keeps people engaged. It keeps people from multitasking, and I know probably some of you are multitasking right now, because I know I do that at meetings as well. But for this one, you want to keep everyone, this is your team, so you want to keep them engaged. You want to look people in the eye. It really helps with, buy-in for your team and doing that brainstorming, just really thinking hard about what else could possibly have caused this problem. And then for the facilitator, you probably want to do a screen share. And I'll show you how that works a little bit later in this presentation, just to have something up on the screen that can capture everybody's ideas and everyone's possible reasons for this incident happening. And what I propose is that you just use a simple Excel spreadsheet. This is not rocket science. You don't have to do anything really special. Just a very simple Excel spreadsheet to capture the ideas of what people are saying and what they think might have contributed to the problem at hand. Next slide. So using Excel, I usually, for all RCAs, whether you use Excel or not, you can, you should have like about 4 or so main categories. You can have more, but it gets a little, complicated. You can have less, depending on the situation. But for the basics, you start with 4 categories, and that's, your leadership or the systems, the policies, the overarching issues that leadership controls, things that are within the staff control, the processes that they go through every day, some of the factors that your residents contribute to the issues. Sometimes taking care of, our kupuna, there are many factors that come into play, making things a little difficult. Everything doesn't go quite as clockwork. And then there's environmental factors like cleaning and disinfection, but also just the structure of your building or, the flow of the work. Things like hand hygiene would fall under that, or possibly under staff control. Sometimes an issue might come under more than one category, and that's fine. It's just looking at things from different perspectives, like when you turn the puzzle pieces around to try to get them to fit. And again, remember that all the causes are welcome. All is welcome, whatever people want to say, and to keep asking why. Don't forget to ask why. Next slide. So this is just, a template of what a spreadsheet would look like. You can also do a table in Word if you don't like Excel, or you can just type it in Word. No big deal. This is not, that difficult. But in this instance, I put the 4 categories, and I started to populate some things that might come into play with this particular issue. You don't have to be able to read that if that's too small, but it's just the idea that you just have a simple spreadsheet or table to capture these ideas. Next. And what's really amazing is that you can take those exact same things from your Excel spreadsheet or whatever you have, and you can plug them into a simple wishbone or a fishbone template as well. So, you can then take your information and make it look really fancy if you want, and put it into all your big fishbone with all the tiny little bones, or whatever other, project, management tool that you want to use. But it's actually getting the information for this that we're talking about today. You can make it as fancy as you want or keep it simple. Next slide. So we're going to kind of take a look at, an example, a case scenario of what would happen here. So this is now your virtual world. Everybody's got their mind going, and we're going to start thinking about what is the situation, at hand. So in this scenario, a staff member has been working while feeling ill for 2 days. Thanks a lot. And then they reported a fever during the shift while they're working. And of course, they were sent home. The employee then calls you later and says, oh, I've tested positive for COVID-19. That one call that you are dreading that you're going to get one day. I have tested positive, and I have worked while I was feeling sick for the last couple of days. Of course, over the next few days, you find out that there are 6 staff members that are now positive, and 12 residents were symptomatic and later tested positive. Oh my gosh. I hope that this has not happened to you, or that if it hasn't, that it won't happen. But this is very realistic. I know several homes in Hawaii that this has happened to. So why did this happen? Now, again, I know your minds are thinking about what we can do to stop that. Oh, well, that employee shouldn't have worked. And, oh, well, we should have done different things, this, that, and the other. Okay, let's not go there. Okay, we're not ready to say how we're going to fix it. We want to know, why did this happen? Okay, so we'll start with some real simple categories on the spreadsheet. to just lead this discussion. And I guess people can put things in the chat box if you have some ideas as to what we can add to this, or I don't know, can people unmute themselves, or is that you can unmute yourself?
Yeah. Would love it if you actually, showed your video and also unmute yourself and just engage in the conversation. That would be great.
I would love to see people's faces if you have a camera. I'm such a hypocrite though that I don't have mine on, so I understand. But yeah, let's talk about that scenario that you just got that call. I mean, this happened, a week ago. You've already taken care of your residents, and the issue itself is not emergent right now. But now we're looking back and going, okay, so what do we do? How are we going to find out why did this happen to us? What's unique about your situation that created this to happen? So do I need to share screen at this point?
Yeah, that'll be good.
Okay. Oh, there it is. Can you see that?
Yes.
Great. So again, this is the most simple form that I can possibly think of to help you with. You don't have to make it fancy. I put the 4 categories just up here on the Excel spreadsheet. And, I thought of some issues to put on here, but they may not be pertinent to your facility. And I don't like to start with leadership, although it may be very important, and you do have to recognize that leadership has a role here. I like to start with everything else, and then we go back to leadership to say, what is it that's needed from leadership in order to, accomplish this or to get to the heart of things? We know that the staff don't make their own policies. The residents are certainly not running the facility. But let's not start there, because it becomes a blame game. It's easy to say leadership should do this, that, or the other. So we can start with the environment. If you can think of some of the things that may have occurred in the environment with the residents or with the staff. The first thing I thought of was, hey, that staff person really should have taken some sick time. They should have recognized that they were sick and not come to work when you're sick. And so is that an issue in your facility, that people don't want to call in sick, or they don't want to, take sick time, or they don't have leave, or whatever the situation? Could this be a possible causative factor, that staff are not taking their sick time? And that may require you to, look back or to think back on your payroll and really see, are you encouraging people to take their sick time, and what is going to be needed to accomplish that? Usually it's a virtue that to work, you should be proud of that your staff want to work. But
yeah, so the chat box, we're getting some good comments in the chat box. So Jeff Galbraith saying so Jeff is saying mutual communication support about not coming to work when feeling ill, or as Maria Castillo says, or maybe they don't have any sick time and it would be unpaid. Or from Donna Leigh Williams, service coordination, some sick policies affect the employee's attendance records.
Oh.
Mm.
Even thought of that, and that's very true. If you're already kind of on the edge where you've called in sick too many times, you don't want to be, getting disciplinary action, especially if the union is involved. I love these ideas. It's fantastic. See, I'm just going to have to add more rows.
Yeah, staff being honest about being sick. Why aren't they honest? That's another why.
Why aren't they honest?
Here's a comment from Jeff again. Leadership and staff, routine surveillance screening of residents and staff when asymptomatic.
routine
When
surveillance and
asymptomatic.
they're asymptomatic. So that
Mm.
goes into the screening process that I think a lot of us have in place, should have in place. Are you screening your employees, for temperature? Do they have to answer a questionnaire? How often are you doing that? And wouldn't it be nice to have one of the screeners be sitting in your Zoom call um, during the RCA to say what it's really like at 6 o'clock or 6:30 in the morning, and everybody's trying to get into work? How do you screen them? Or is it thorough? If not, why? Do we have the right equipment? Do we have the good thermometer? Are we asking the questions, or are we just letting people go because we see them every morning and we know them, and they look fine? So that's really good. I'm not sure, where would we put that? Is that an environmental issue? Is that a leadership issue? It's probably a little bit of both. Um, or maybe some of you have staff
Ah.
that do their own screen, that take their own temp and report it instead of having an actual screener.
Maybe it's under assignments. Nobody's assigned to do this,
Nobody's assigned to do this.
or too many people take turns, and so it's not done consistently. I don't know. Just
Could be anything, right? It really
yeah.
depends on your um, your situation, and that's why we want to hear all the different ideas, because I bet you every one of these ideas pertains to somebody on the call today.
Hi, this is Donna. Can you hear me?
Mm-hmm.
Yes.
I decided to talk instead of type because I it's probably easier.
Hooray.
So I'm in a I guess a middle management role over here at HMSA. So I think it all begins like with at the leadership level at one point because we're the ones who set the policies and procedures. We set the culture for our staff. And for this COVID in the very beginning, I think now the this one employee is sick. There it was unprecedented, and we weren't sure. So, I can just say that if leadership, looks and evaluates the situation at hand and builds that culture that we care about each and every one of you, including our members. And we want us all to be safe because we're all in this together, and come up with policies and procedures, where like you talked about, like the calling in sick. So, just for example, um, and HMSA was very an integral part with the state in all of, I guess, their plans and everything because they wanted to be a very active community member. So what we did, is everybody was sent home, and so we worked at home. Policies are only the um, people who had to come into the office came into the office. If you could work from home, you work from home. And then with this sick issue that we're talking about, which I think was great, that they came up with giving us additional sick days that didn't affect our attendance. They wouldn't ask any questions. They gave us additional sick days to create that culture, because not only um, did we have to do our work at home? A lot of people had their children at home. They didn't have daycare. They have elderly parents. So if you needed to take a day off because of whatever, whether you're sick or your child is sick, they didn't question it, but they only gave you so many days. It's not like you could take off like for weeks. So they gave like I'm just sharing that with you guys. They gave us like 6 days, and not everybody used it, but it was there for you to use. And some policies make you take off your YPT days, so many YPT days before your sick leave kicks in. This didn't apply to that. So I think, and knowing, like, I see some of my employees on this call, that they all had to work from home. Do you have the tools to work from home? If you have kids, let us know if you're having issues, so that we can support you and we can kind of be a little bit flexible, but just having that open communication. I think. Okay, sorry. Thank you.
No, that's wonderful. Those are all such wonderful comments. And you ended with that open communication. That's what it kind of all boils down to. And that it was open communication both ways.
Yes.
You know, that yes, employees need to be open about their situation, but knowing that the leadership is developing this culture of open communication and that they're not there to just, hand out discipline and punishment, but that they can work with you.
Yes.
Because I'm sure that many of our staff, all healthcare workers, I don't think that there's as much transmission of COVID-19 from the patient to the staff. I think many staff members come in sick because they have COVID at home. Someone in their family, situation, their living situation, has gotten it from another coworker or exposed at their job, and they come home with it, and then all the family members at home are exposed. It would be nice to be able to call my boss and say, my son who lives with us may have been exposed. We don't know yet, but I'm not sure if you want me coming to work right now. And, let's work out a plan, of course, in accordance with CDC guidelines and the state of Hawaii and all of that. But how can we work it out so that it works for our facility? And having that caring and that open communication, I think, is very key to that. So thank you. That has actually happened to me, not me personally, but people will call and say, my employees, husband was exposed. What do we do? When should we get tested? How long should the person stay out? And it's a little bit different for each case and depends on what kind of job, role they're in. But it can get complicated, and we have to have that open communication in order to get the true story, because sometimes people don't want to tell you the whole thing until you ask the questions like, well, what's really going on, and how can I help you as your boss? How can I, help you to stay safe? And, I don't want you to be sick, and I certainly don't want you to.
Yeah.
And I'm glad to hear that HMSA is so progressive with that, extra days off. That's really wonderful.
Yeah. So I'm kind of wondering if this is time. We did have a case submitted from Vanessa Burns, and maybe you want to share anything on your facility's approach to a case like this, and maybe you can help us add to some of these ideas.
Wonderful, Vanessa. Thanks.
Hi. So
Hi,
we can hear you.
Oh, good. One of the scenarios that we recently came up with is that we had a staff person test positive, and the questions that we weren't asking at the screening table is, are you around anybody that is showing any signs and symptoms? They didn't have to test positive, but are they showing signs and symptoms? Because we found out that at least a week prior to him or her testing positive, she had the sick family member that's in the same multi-generational household. So we started asking that question because it's like, you go to the screening table, no, I'm not sick, I have no symptoms, but they've been around somebody else that has. So from that, there's potentially 4 scenarios that a person could test positive for COVID. And where's my notes? Sorry. So one of them is that during the routine antigen testing within the facility that relates to the positivity rate that CMS puts out or the state puts out, you happen to have a positive person. If they're asymptomatic, we're just sending them to, if we're using the BD Veritor, which gives the false positive sometimes, we then do the Bionex Now test, which has more accuracy and not giving the false positives. But we're also sending those staff to get a confirmatory PCR PCR test. You could also have a staff person exposed with symptoms or without symptoms. They are taken off the schedule and then sent for a PCR test. Hopefully they're calling in and not showing up at the door saying, oh, I was exposed and I'm here to work. When staff call out sick, we're asking the screening questions of them. And if they have any of the symptoms, then we're saying that in order for you to return back to work, you must get a PCR test to rule out coronavirus. And then we also have where we've had staff that got PCR tested outside of the facility on their own time, and the test result has come back. So where staff are exposed or staff calling out, and if they have any signs and symptoms, and then if they've PCR tested positive outside of the facility, they are taken off the schedule, and we're still working on, are we going to be doing a 10-day quarantine, or are we going to be honoring for our residents safely the 14 days and continuing with the 14-day quarantine? Does that make sense?
Yeah, so it looks like there should be a number 4 under environment should be maybe screening questions.
Yes.
Because you found out new problems with the screening questions.
Yes. She had actually been in the facility working for 3 days, cleared the screening questions, and then called out on Saturday. And then on Monday, it was confirmatory positive COVID.
Yeah, any other thoughts from others' experiences?
This is Donna again. Sorry. So Vanessa, thanks for sharing that. I don't work in a facility. I miss working in a facility. I feel guilty for not being there anymore. But anyway, when I go to, I live close to Castle. So when I go to Castle, I know what their system is. I mean, they check every employee and they check every visitor every single day, and they ask them all the same questions every single day. They also provide hand hygiene as you enter for everybody when you go in. And so the screening questions, I think, are very, you have to be consistent, and it's very important because they still ask you, have you been around sick people, like you said? Have you traveled outside the outside of your home? Have you anybody in your family traveled outside of the home? Because maybe I didn't, but maybe somebody else did, right? Are you having any symptoms? Is anybody else having any symptoms? So I think that is, to have the right questions, and not just for, the employees, but also for any visitors or any patients that are coming in for any kind of treatments that they could do there. And then on top of that, it would be education, because some of the staff as well as patients, they're going to get all pissed off, right? Like, why you keep asking me? You saw me yesterday, and but well, every day and every shift is new. And so I think that the education, even like you're doing this today, I think it's very important for us to, attend, as many of us to attend this, so that we can learn how to make this better, because none of us have lived through anything like this in our lifetime. So education is so important, to try and get whatever you can, like even within your facilities, like, I don't know if you have daily huddles or weekly huddles, or, just to have the reminders, right? Because people have to hear things 7 times before they can absorb what's going on. Wash your hands, wear a mask, use hand sanitizer, limit your social, interactions, which is hard for us because I think our generation, have been spoiled. So along with the screening questions, I think that comes a lot of education.
Great. And I really like the fact that, not each facility, each person has gone through different scenarios, right? Not everybody has covered every single one. So sharing amongst all of us, I think, is going to be, it'll help everybody grow faster and improve faster. Yeah. Any other facilities have stories to share
I put some information under residents because I was reading an article about some of the obstacles in dealing with, you know, folks in long-term care and wearing PPE basically. And part of it is that, you know, a lot of our elderly have hearing issues. And as somebody, I personally have some hearing problem, and sometimes I can't make out the words that I'm hearing, and I have overcome that by being able to read lips or to read facial expressions and the context of the situation. But when everyone is wearing a mask and maybe a shield and goggles or whatever, it's very difficult if you can't hear to understand what the person is asking you. And so, you know, a lot of times they'll say, what? What's that? You know, I can't hear you. You have to get closer, meaning you're within the 6 feet, definitely, very close and, you know, and personal with the resident. And then sometimes residents have tendency to have long conversations instead of just short answers. It might be, well, you know, back in the day when I was young, this is how we did it. And you know, with some of the isolation and other issues, there is a need for connection and longer conversation. But then that puts you within that 6 feet for more than 15 minutes and makes you very high risk. Even when you're wearing a mask, it can be a risky situation. Or many people have had to remove their mask because the person can't understand them. So they pull down their mask so that they can talk clearly and the person can understand. And do they put the mask back on? Do they, you know, are they within that 6 feet for 15 minutes? All of that comes into play just because of the issues of factors that the residents have. It's not their fault. This is just life as it is.
Absolutely. And I guess so we need to have other strategies, you know, things like maybe use hand motions in addition to speaking louder, or using different words instead of speaking louder, or writing things down if they have trouble hearing, you know, using a board to write, you know. So yeah, I think those are great ideas.
We also have residents that come to be wearing PPE, like face masks and stuff, especially folks that are going out routinely, like for dialysis and such.
Under residents, I think another category is probably dementia.
Definitely, you know, I know that a lot of our residents, you know, do have dementia, and it can't be any easier if you're already demented and everybody around you is all geared up in gowns and gloves and masks and shields and goggles and stuff. That must be a little frightening to some of our residents. I don't know. I haven't heard of any, you know, any comments about that to see if that's true, but I think I would be a little scared if I was in that situation. And if I thought I was back in World War II, I might think that, you know, we're getting ready for some kind of war action. And it's frightening. So how do we comfort and, you know, keep our residents secure, feeling at the same time protecting ourselves, because that is number one right now, is protecting the healthcare worker, not just the patient. So that's good, really some good things. Now, I noticed that our physician, Dr. Wen, went right to solutions. And I really do love it, because that's what makes the RCA fun, because you can come up with the most creative solutions. So you'll notice, like, I would build in another column maybe next to whatever questions we're asking, why, you know, capture that, because I'm going to forget. Yeah, we can come up with some other things instead of just saying they're hard of hearing. Oh, well, I can't do anything about it. Yes, you can. And we want to capture that information too, because although it's not part of the root cause, it will be part of the solution and the fix. So that's great. But yeah, that's our tendency, is how can we fix the problem? And that's wonderful. To me, that's what makes this whole process really fun. And eventually you create this puzzle and you get a real clear view of who you are as a facility, what your identity is in the community, what kind of people you take care of. You know, it builds upon your self-view and making sure that leadership, because leadership is there right in this meeting, that we're building the culture that we say we want. And if the staff aren't hearing it, why not? What is it that we need to do? We can't just talk about culture. Culture is not something you just talk about. You have to live it. So how can we live it? And that's where the next, you know, set of ideas would be. And it can be an ongoing team. You can create little teams from this RCA when you identify problems.
Great. So we just have 5 minutes left, but a couple more minutes, a few ideas would be great. I know, you know, looking at the names here, I know these facilities, and I know some of you have had these scares that happen. Yeah, maybe you can contribute to some of these root cause analysis items here, the things that you learned.
Did this already. What did you find was the real root cause? What was the main, I'm sure there wasn't just one, but what's the main cause of a COVID outbreak in your facility?
Or maybe it just uncovered something that you didn't, wasn't the root cause, but it uncovered something else that might have been. Yeah, staff education and awareness is critical.
Definitely.
Yeah. So.
I even struggle with that here at making sure that everybody heard the message.
Signage. Yeah. Communicate in more than one way. And probably in multiple ways and in multiple different locations and scenarios.
Yeah, so you know, I also, this is Donnelly, I also hear, like, now that you say that, and communicate in multiple ways, you know, and I understand that some of the people on this call, their facilities are smaller. You know, I know that we have the CARES Act fund that you can access the money, but that takes a lot of paperwork and time to try and get that. However, you know, something as simple as, I don't know, maybe every hour on this might not be good for the hearing people, the non-hearing people, but, you know, can say, hey, just a reminder, you know, that, you know, wash your hands, wear a mask, you know, something overhead. Just a reminder. I think once I went to Costco and they're like, okay, keep your distance, just, you know, in quotes, since it's during the COVID times or something, and, you know, blah, blah, blah. Have that. And then I know some places would have like, you know, signs on the floor, and some people would have handwritten signs, some people would have these fancy dancy signs, but, you know, at least there was like some kind of signage around. And then also, like, you know, I see on the screen here, one of the comments is private caregivers coming in, and that's why, I mean, it's sad, right, for the residents when their families can't come in or their caregivers can't come in, but there's a reason for that, right? You know, so they have to be, you know, screened very carefully. So,
Oh, here's a solution. Celebrate being COVID-free and praise staff for keeping it out. Clearing 14 days post-exposure is worth celebrating.
yeah, that's awesome.
That's great. Okay, so it looks like it's 2:59 and we're having so much fun here. Oh, reminders to everyone that shared spaces include kitchen, countertops, food prep, restrooms, etc. Even if not there simultaneously, may be anything aerosolized may transmit illness, right? And so she attended the Safe Environment lecture yesterday, right, with the nursing home ECHO, maybe, and covered that. Okay, so anyway, thanks so much, everybody. I just want to remind you that in order to get your CMEs, please click on the link, and maybe Michaela can just put that link there one more time so that people can click on and get their CMEs. If any of your friends and colleagues missed this presentation, these sessions are recorded, and you can listen to these on your own afterwards, but we won't be able to offer CMEs for those sessions, the recorded sessions. So next month, we will be talking about creating flow sheets, and Joy Adab will be presenting on that again. And we'll be focusing on telemedicine or whatever flow sheet process you want to talk about. So hope to see you then. Bring some more friends and share your case scenarios and situations. So thanks, everybody.
Thank you.
And thanks for sharing.